Alex Stevens, and I'm a patient intake volunteer at Mariam Clinic.
Hi, I'm Saeed. I'm a patient at Mariam Clinic.
And today we're going to talk about using a glucometer to check your blood sugar. So a glucometer is a machine where you can draw your blood and put your blood into a strip that the glucometer reads, and then the glucometer will sense how much sugar is in your blood. So we have the glucometer, and you have to buy strips to go in separately, as well as lancets to prick your finger to get the blood for the strip. So inside of the glucometer, it comes with, the whole kit comes with instruction manuals if you need additional help. And it also comes with a glucose logbook. So basically this logbook has, you put the date and then maybe what time of day roughly that you checked your blood sugar and what it was, and then if you gave medication if it was too high. So this is really important because it helps your doctor to track how well your diabetes is being managed and how well your blood sugar is being controlled. So this is very important. And then as far as the monitor, it has a little carrying case, and I would very much recommend that you take it wherever you go with you in case you need to check your blood sugar.
Okay.
So let's see, we'll go ahead and start going through how to take the myth reading for it. All right, so now we're ready to go ahead and start testing your blood sugar. So I'm going to talk about the pieces to it a little bit because it's important to understand like the lancets and the strips. So with the strips, and each monitor is different. They come with different instruction manuals, so there might be a few little different things, but if you're ever confused, you can go look in this to see how to save results or how to know when the monitor is ready to test. So with the strips, make sure that your strips you're buying match your monitor. For example, if there's a certain type of strip, it will have the name of the monitor, and make sure it's compatible with your monitor. So with the strips, I can get one. There we go. I'm just going to show which part to stick in the glucometer and which part to collect the blood with. This is the part that you stick into the glucometer, and this is the part where you'll collect the blood from your finger. When you're collecting the blood, you don't want to go on top because that can give you too high of a false high result. You want to go at a 90-degree angle, and it'll collect the blood like that.
Okay.
And you don't want to give too much. You don't want to oversaturate it, but most monitors should start counting down or give you a signal when you have enough blood, and you would remove your finger at that time.
Okay.
Most, even if strips look different, they normally have, I always look at the little racing stripe there because that shows you that that's where the blood's being collected. That's how I know which end to use for blood collection on different strips.
Okay.
So I'm gonna go ahead and put this back real quick. And then with lancets, so you're gonna want to unscrew this one, and there's also things called lancing devices where you could put this into a lancing device and you won't have to do the sticking. You can just sort of place it on your finger and click a button, and it's a little faster.
Okay.
And a little easier. So with these, you want to do it on your fingers. Always try to prick your fingers, and you can do it on any finger. It doesn't matter.
Okay.
But I would recommend rotating fingers because then one will get really sore if you keep sticking that one. So another tip is to go in at the side. Don't go straight on into your finger, go at the side. And I also recommend if you know you have trouble getting blood, you can rub your hands together or rub your fingers together or run under warm water just to increase the blood flow there.
And all these lancets are non-reusable, right?
Right, they're non-reusable. So what I would recommend doing is they also have a sharp end, and in a hospital, they have a container to dispose of sharps, but I'm sure nobody has that at home. So what y'all can do is get a big, like a laundry detergent, a plastic, like sturdy sort of container, like one from laundry detergent or an old water bottle even, and put these in there, and then you can bring them here and we'll dispose of them properly.
Okay.
Because it is dangerous, especially with kids and pets around, to have this in a trash can. Somebody could stake themselves. So I think that's pretty much it about the lancets. And yeah, so I would also recommend every time getting alcohol pads and wiping that area before you stick it.
Okay.
So yeah,
All
I
right.
think we're ready to go.
All right.
All right,
Okay.
I have this ready.
So unscrew it up just like that.
Perfect.
And this would stick into the lancet.
Exactly,
You
the
said.
pin. If you use the
okay.
pin, it would
All right.
stick, and the pin would sort of do it for you.
And you should kind of do it for unscrewing it,
Yes.
sticking it in.
Yes, because then you could stick yourself, and that would be good.
All right.
All right.
Does it matter how much blood?
Normally the monitor will tell you, but you don't want too much, and you're gonna want to wait until there's an icon that says blood. Let's see. And it'll have a little blood droplet on here, like that,
Yeah, like that.
and then you will. It's reading. All right, and now we have a reading.
Okay.
And you can just wipe your finger off. And then we would record this in your logbook.
Okay.
So today is the 5th of August. And some monitors, like this one, if you can see, have the date and the time on them, which is really nice because it helps you when you're logging it, except this time is wrong. It's 11:50, not 9:50.
Okay. So this is I haven't gotten breakfast, so this would be for breakfast.
Right, and you
Before
would put
this is
before
before
breakfast.
breakfast, okay.
Yep.
All right.
And it's 184.
So how many times do you have to do it per day? Does it matter? Or
It will depend on what your doctor tells you to do.
Okay.
Normally, doctors specify how many times and when you have to check your
Okay.
glucose during the day. Also, anytime you need it. If you have diabetes and you're taking insulin or medicines for it, you can become hypoglycemic, which means your blood sugar drops too much, and you would feel really nervous and sweaty and very sort of cool and like pale, and you would just feel very anxious and your heart might be beating really fast. If that ever happens, you would always want to check your blood sugar and make sure it's not too low.
Okay.
And if it is too low, then you would want to have a small snack with sugar, like they say like 3 tablespoons of honey or like 3 lifesavers, or like a small, like half a can of regular soda to try to increase that blood sugar, because it can be dangerous if your blood sugar keeps dropping.
Okay.
So yeah,
All right.
perfect.
Thank you.
Thank you.
Thank you very much.